Thanks, Dr. David Notrica, for talking about Trauma Conference International. You just held your first meeting summer of 2016. So who are the organizers and how did you just decide to start a new trauma conference?
So the organizers kind of started with the same surgeons that were doing the Southwest Trauma and Acute Care Symposium, or the STACS conference. So it was myself, Peter Ree from the University of Arizona, now at Grady in Atlanta, and Chris Salvino, who's at Lake Havasu. And the three of us initially wanted to grow that Southwest Trauma Conference to an international conference, but that conference is done by the Arizona Trauma Association, and the ATA didn't really want to do an international conference. Their focus was Arizona and the region. So we decided that there was a place, that there was a need for an international trauma conference in multiple languages, and so we reached out to some of our friends in Mexico and South America, and also to some of our friends in Canada, and said, all right, would you guys be interested in sharing this with us? And so Neil Perry and Chad Ball from Canada thought it was a great idea. Chad was a huge a cheerleader for us, and as we moved through the process. And then Felipe Vega down in Mexico thought that there was a great opportunity there. And then Esteban down in Bolivia actually said, yeah, I think that this is something that we really would benefit. And so we kind of partnered with those guys, and those guys contacted their friends in the Pan American Trauma Society and the Canadian Trauma Society, and next thing you know, we had people and a place, and we're ready to go.
Great. So talk about explain the simulcast and how this various groups of people participated from their home states, their home countries.
So, it's amazing because when you go to an international trauma conference or an international conference, a lot of times they all just kind of agree, we're going to speak English, and it works well if you speak English, but and it works well for the people that where English is their second language. But you get in a situation where people are asking questions, and the questions. It's a lot of times it's difficult for speakers from other countries to understand the questions, and it's difficult for them to answer, because even though they can practice their talks to and get it perfectly, when it comes down to the question and answer, we lose a lot.
Right.
And so that was kind of how we said, all right, well, if we're going to do this simulcast, we're going to do it in multiple languages, and that's where the concept of the simulcast and what we were trying to do started. And then the other thing was, a lot of these countries, it's very expensive for them to travel the United States. And if the goal of the conference is to spread knowledge and share knowledge between countries, then there are two things that have to happen. One is we have to figure out what they're doing and understand that, and then we have to take what we're doing and make it accessible for them, because to have a conference in the United States where hotel prices are expensive and travel is expensive, that's not going to accomplish the goal, because they're going to say, well, I've only got a certain amount of money to spend, and I can't travel to San Diego or Toronto or to get that content. And so the simulcast makes it accessible for everyone.
And so what kind of participation did you have overall in the various places?
Well, we were actually quite surprised, because we were hoping that we could get 10 or 12 hospitals to simulcast. At the end, we ended up with 65 hospitals.
Wow!
And so, we had hospitals, obviously in the United States and Canada and Mexico, but we also ended up with hospitals in Bolivia, Guatemala, Cuba, Argentina. It was Peru. it was absolutely phenomenal, and I'll get you the whole list. But we were just floored. We were just floored that there was that much interest, and not only were they listening, but the feedback that we got was you've got to do this again. This was a great conference. This is something that we really need, and and we take trauma education a little bit for granted in the United States because there's so many great venues where we can get trauma education in the United States, but it's not that easily accessible in Spanish or in South and Central America.
And you said it was done in Spanish, English, and was there a third language as well?
No, actually, we only did it in 2 languages. We wanted to do it in multiple languages. It turns out doing a conference in a second language is very expensive. So
Sure.
yeah, so for our first conference, we basically said, all right, well, we're going to do English and Spanish because we can reach the most people in a time zone that's reasonable. And so as we pared it down, we had to be a little bit more focused in where we're going to put our resources.
Sure.
So for this year and for last year and for this year, it's just going to be in Spanish. But we do hope to offer it in multiple other languages as the conference grows. And so that's one of the goals for the conference.
Okay. And you were in Phoenix at the time of the conference, right?
Well, so we actually did the conference from San Diego.
Okay.
So, and San Diego is very easily accessible from Mexico and from South America. Matter of fact, what most of the surgeons who came from Mexico did is they flew to Tijuana, then they just drove across. So that's it's a very easy drive, very accessible for them. The folks in Canada didn't have any problem getting to us, and then we had a few other people from South America who got direct flights to San Diego. It was a very good location for the first conference, and we think Toronto will be the same. It'll be easily accessible.
Okay. And were the presentations all done from San Diego, or did some of the presentations take place at the other hospitals?
So that's a great question. We actually did all the presentations in San Diego, and that's where our interpreters were. And there are a lot of logistics that had to take place, and we were worried that if we had our speakers all over the place, that we would have time lags and other issues that we might not be able to contend with. And then we also were able to control the quality of the video and the quality of the sound, and so we brought everybody to San Diego to speak. And they all presented in their native language. So if they were from South America, they presented in Spanish, and and if they were Canadian, they presented in Canadian.
Right. Canadian. So what other focus or features did the conference have besides the bilingual presentations? Was there a clinical focus or a particular panel that was distinguished it?
Yeah, so our focus for the first year was really on resuscitation, so the first phase of trauma, and there are a lot of reasons for that. It's applicable to lots of people, from emergency physicians to trauma surgeons. A lot has changed in the way we resuscitate patients. So there was a topic that really had undergone a lot of evolution in the last 10 years. So we thought there was a lot of learning that could be applied. And then the other thing that we did was we focused on some controversial areas. So Dr. Feliciano and Dr. Maddox debated hypotensive resuscitation. So the concept that you would actually take a patient with a low blood pressure and not treat that blood pressure, but simply get them to the hospital as quickly as possible is a relatively novel concept and still controversial. And so we debated the pros and cons of hypotensive resuscitation, and that was pretty neat when you've got 2 of the fathers of trauma in the United States debating a topic that's that important.
Indeed. And you said next year the conference will take place where?
So it'll be in Toronto. So we haven't nailed down the hotel yet, but it'll be in August in Toronto. And as soon as we get more details, I promise we'll get them up on the website, which is the traumacon.org website.
Okay, very good. Last thoughts about your experience in this one, or your plans for the next one?
We learned a lot doing it. There was some amazing feedback we got, but we learned that there is going to be a time lag, and so we have to allow a little bit more time for questions. That was one of the things that really disappointed us, is that the questions came in after we had gone on to the next talk. And so, there's just all types of technical logistics that happen that you don't really expect. So, that's it. From a technical standpoint, I think the other thing is we realized how much we have to learn from people in South and Central America. So in the United States, we think that, in the United States and Canada, we know everything about trauma. And then you have surgeons coming from other places who bring new ideas, and that was really cool. And so we learned a lot in the process. So it was great.
Very famously, the Bogota bag, right?
Yeah, absolutely. Absolutely. And that's, now in its present, iteration is everywhere in trauma. You can't even find a surgeon who doesn't know about leaving the abdomen open and intra-abdominal compartment syndrome. So, yeah, quite a change.
Very good. Well, I congratulate you on the success of the first conference, and I hope to see you at the next conference.
That would be great. I really appreciate it. I really appreciate the chance to talk with you.
Nice to meet you. Take care.
Thanks, you too.
Thanks for checking out the Op Report. Help us keep conversations alive on topics in general surgery. Check out more episodes of the Op Report and other OnSurg content here at YouTube. Find us at Facebook. Follow us on Twitter. And find our homepage at onsurg.com. Join the conversation and tell us what topics you'd like to hear about and what people you'd like to hear from.